have Caryn, who's doing number 4 project from storytelling, and the speech is entitled Dealing with Bad News. Caryn.
Have you ever received bad news from your doctor? Have you ever thought about how you would handle it? Or possibly how your doctor would even tell you? Mr. Toastmaster, fellow Toastmasters, welcome guests. There I sat. It had been a hectic, super busy day. Next to me was a pile of charts this high. And I still had to review them. Have you ever been in that situation where it's the end of your working day? It was actually after 7 o'clock at that point. And you're looking at a whole pile of work that you really were too tired to do? Well, I'll tell you, that's exactly where I was at that moment. Oh, Mr. Wilson's ultrasound was normal. He should follow up in 6 months. Oh, Dr. Brzezinski's colon polyp was benign. However, given his family history, he needs another one in 5 years. Mr. Condavidi's liver tests are improving. However, they were so high to start, he probably should repeat them again in 2 weeks. And so on and so on. And then, all of a sudden, a chart made me stop. I thought, oh no, Miss Jones has cancer in her colon biopsies. What if you were the one that was going to get a scary, serious diagnosis such as cancer from your doctor? Have you ever thought about how you would want your doctor to tell you? Would you want your doctor to have their office call you on the phone in the morning and say, come in today, we have to talk to you? Like they do on TV, face to face? Would you want to wait for a doctor you knew personally that you had a connection with to tell you? Or would you just want to know ASAP? There's really no right answer to those questions. Personally, from my experience, the best thing to do is to just make that phone call. Think about it. If my office were to call you in the morning and say, oh, we need to see you right now or this afternoon, what would happen? You would probably get panicky, rearrange your entire schedule, possibly call a friend or a family member to come with you for moral support, because you don't know what's going on and the staff wouldn't tell you. And then think about the other side. That doctor has now fit you into their schedule. Not that they didn't want to, but it was already packed. So there's a chance you'll get news like that in a hurried, rushed manner. And then you have to drive home safely. So from my perspective, I would rather you be at home when you hear the news. And I know at that point that I'm not rushing. So that's probably, from my perspective, the best way. So I give a call to Ms. Jones. Hello, may I please speak to Ms. Jones? Someone says, this is Ms. Jones. Oh, Ms. Jones, this is Dr. Berkowitz. I'm Dr. Conti's partner. Dr. Conti is away from the office this week, so I'm calling his patients with their biopsy results. Oh, thank you so much, Dr. Berkowitz. What did my biopsy results show? Oh, Ms. Jones, I'm sorry to tell you that your biopsy showed that you had cancer in your colon. There's always a moment of silence at this point. Sometimes it's very brief, sometimes it's quite long while they're thinking about what I had just said. Dr. Berkowitz, do we know how big the tumor is? Where it's located? If it is spread? What are my chances? What do we do next? Well, Ms. Jones, we need to do some more testing because right now I can't answer most of those questions as fully as you want to know those answers. And then we proceed to chat for another few minutes. I feel that I'm personally shocked and amazed that she is so composed through this entire conversation. And I really feel like I make this connection with her. Dr. Berkowitz, she says, so what do we do next? Well, Ms. Jones, next, we have to order a CAT scan to look at the size of the tumor and see if it's spread. And we also have to order a surgical consult. My office staff can arrange all of these tests and consults for you tomorrow morning. When are you not available next week? Oh, let me just look. Oh, Dr. Berkowitz, I can be available any day next week except Wednesday afternoon. Wednesday afternoon, I have a hair appointment, and I can't be available during that time. And I say, oh, Ms. Jones, I totally get that. I too would rather die than miss a hair appointment. And I'm thinking, what did I just say? What's worse is, what is she thinking? Oh my, complete panic. Mrs. Jones, I am so sorry. Those were such poor choice. That was such a poor choice of words. It was a judgment about how hard it is for me to make my hair appointments and keep my hair appointments. It had nothing to do with me judging you. Dr. Berkowitz, really, it was okay. It actually made me laugh, brought some levity to this conversation. And then she said something that I did not expect. And it actually made me see the world just a little bit differently, even to this day. And it may help you too. She said, Dr. Berkowitz, I've learned over the years that I can't worry about things I just can't change. Think about those words. How would your outlook change if you didn't worry about all the things you couldn't change? How much happier and calmer would your life be if you didn't worry about all the things in your life that you couldn't change?